Okay, good afternoon, good morning, good evening, wherever you are watching, listening, or potentially even, I don't know, downloading and watching at a later date. My name is Mick Hughes, founder of the ACL Hub, and I've got the absolute joy and pleasure to be joined by Ellie Somers today. Ellie, welcome to the ACL Hub, and yeah, allowing me to pick your brain for the next hour or so.
I'm so thrilled to be here. I've been a long time admirer of your work, and I'm just grateful to be invited and to have a chance to talk shop with you. It's a pleasure.
Very good. Oh, and likewise. I've read your name in many circles around the sporting environment for a long time, and it's nice to be able to sort of sit down and talk shop. Can those that yeah, I've got people from all around Australia, around the world, patients, clinicians. Some may have heard your name amongst the basketball community, soccer community. But can you give our audience a little brief? Otherwise, I'll butcher your biography and I'll probably not give it the credit it deserves. But can you just give our ACL Hub community a little overview of what you currently do and maybe some of the past sports you've worked with and some of the levels of athletes you've worked with in the past to give us a little snapshot?
Yeah, absolutely. So right now I work with the Washington Mystics in the WNBA. I'm the director of athlete care and performance. So I oversee medical and performance, basically, the whole ACNP staff, as we call it. Um, I'm also a physical therapist. I've been a physio for, I don't even know if I could tell you how long, probably 15, but over 15 years,
Yeah.
close to 16 years probably. Prior to working in the WNBA, I did work in the NWSL as well. I was a director of medical and performance at the Chicago Red Stars. And then before that, I was director of rehab at the Seattle Reign as well. Before that, I was running my own private practice working with women athletes. So I've had quite a road, I guess you could say. Maybe not
Yeah.
the typical road into professional sports.
Yeah. What makes you say that? Did just for the private practice work, getting into soccer or football? Depends on which region. We'll call it soccer for the context of
Yeah.
tonight. I've know I've got some friends in the UK that are very pedantic about the use of football versus soccer. Here in Australia, we call it soccer. So we'll probably just keep it simple, keep it soccer for the rest of the chat.
Luckily,
Um,
I speak both languages, so
yes. Yeah. So what
um,
it's yeah. So what's he thinking there that
so
about yeah.
yeah, when I was a young clinician, there were like no jobs. I wouldn't say no jobs, but the jobs in pro sports were just not very robust.
Yep.
And the pathway to get there, I don't think was maybe as clear, or at least it wasn't as clear to me, at least in the States.
Yep.
And so, I worked in private practice and then just ultimately decided to start my own business so that I could sort of specialize and work with the athletes that I wanted to. Um, and in doing so, I built some great relationships with folks. And around that time, jobs started to just expand. And I would occasionally throw my resume in the ring and get an interview and get turned down. And I just kind of stuck consistent with the work I was doing with the people I worked with in Seattle.
Yeah.
And then there was a day shortly after COVID was kind of like, I'm just going to say like dying down. Seattle Reign was hiring for the director of rehab role, and I happened to
Yep.
know the person in the role. You probably
Yep.
know her as well. Nicole Sertica was the
Yes.
woman
Yep.
in that job. And I reached out to her and expressed interest and interviewed and ultimately got hired and totally pivoted from private practice into pro sports at that point. Uh,
Yeah. Wow.
yeah, and
Big
it's been kind of a
and
crazy journey ever since.
yeah. And have you gone all in now, or do you still have your clinic that you started, and do you still yeah sort of
So
dip into that
no, I
water
don't
again?
have a clinic space anymore. I was working out of my garage, but I did do a lot of private consulting work and coaching online. So I retained maybe 10 clients since I sort of shut the business down,
Yeah.
that I just do strength and conditioning work with online.
Yeah.
But yeah, since then it's just been kind of all in. You really don't have a choice.
Yeah.
I mean, maybe you do. I just not prepared to make that choice and do
Yeah.
double duty. It's just a lot of
Yeah.
work. It's time. Yeah.
Agree. And I think that kind of environment's changed. I reflect on um, when I was a new graduate. We're of the same era. 2010, I graduated from physiotherapy school. So I've been a physical therapist, physiotherapist for 16 years now. And I remember like when I was a new graduate, my boss at the time, he was kind of the last of the full he was the last to join the full-time professional ranks, like in the major sporting codes. We've got a rugby league team, rugby union, kind of close is the probably closest resemblance in the US for the US audience, but rugby league here in Australia is a very strong sporting code, and um, the club that he worked for, he was kind of the last one to join as a full-time employee, and up until then, he had three clinics. He was part-time, so the players would come into the clinics to get treatment, and there was definitely an era of clinician that could probably have the clinic, be this full-time physiotherapist. That players would come to you rather than you be on site all the time, and um, I can't. Well, there's of all the major sporting codes here in Australia now, rugby league, AFL, soccer at the higher levels, you'll just have full-time staff now, and I would find it very very hard now to for any full-time head physio to still have a clinic. They may
Yeah.
have like maybe a part ownership, and there's an agreement that they kind of come there and work in the off season or
Yeah.
something like that. But holy cow, it'd be the demands that you've got now as a full-time head physio, and I think the expectations and all that kind of stuff. I think it's very different to how it was potentially, 20, 30 years ago when you could probably do it all. And so yeah, no, I
For
can
sure.
understand why
I,
you've had
I
to sort
can't
of
even
cut.
imagine. Yeah, I can't even imagine. Yeah, it's just so much time. And part of being involved in pro at the age that I was is there's also just such a steep learning curve. Like I was very experienced as like a clinician, and I knew how to do the work, and I knew how to do return to play and work with people. But then there's those other, just all the other elements, the dynamics of working with coaching staff and with performance staff regularly, and front office and
Yep.
all of the elements that go with it. I still feel like I'm learning um, how to do that and how to do that well. And the thought of having to do anything outside of the work that I do there is still, it's too much for
Yeah.
me to
Yeah,
even.
I think sometimes you just have to sort of know where your kind of limits lie, and yeah, if you're on a pretty steep learning curve, it's just you got to make sure that you sort of probably keep your bandwidth contained to
Yes.
what's actually doable rather than try and be a jack of all trades. What inspired you to start with, make that leap to want to be a full-time physical therapist with Seattle? What was and even before, and having an interest working in sports, like were you a student athlete, get injured and broken down many times throughout your teen
Yeah,
years? The typical story of a physiotherapist wanting to be, was that you, or
of
yeah, tell us a little bit
course.
more about that.
That's Yes. Yeah, I tore my ACL in high school. I played soccer, football, as we call it. And that changed me. It led me down the path of being a physio. It was always a dream of mine to just be able to help athletes like me and move them through that process as well. And then you get out into the real world and you realize like you're not exactly always seeing athletes all the time in private practice spaces. And it became a challenge to figure out, how do I make that happen for myself? If I want to work with people like me, how do I make that happen in reality? That's when I started my practice. And then truthfully, I was just kind of ready for a new challenge at the time that the rain job came up. Um, Ready to be pushed into something new, and I had always dreamed of being in pro sports, but never really saw it being a reality.
Yeah.
So when it came up and it was local, it was like, oh, what a perfect opportunity. I could go do this, and not have to like move my life around to make that
Yeah.
happen.
Yeah.
And, and then 5 years later, 6 years later, I've moved my life around
You've
quite
had
a
to move a
bit.
lot around.
Yeah, took the leap in.
Yes, yeah, no, that's cool. And what's obviously tonight we will probably want to talk a little bit more about ACLs and obviously with working with in basketball now, but soccer in the past. There's more to both those sports than ACLs, but they certainly would take up a big chunk of your well, yeah, not probably not your caseload. It's probably going to be only a few each year, but they definitely take up, that severity of that injury is such a long-term injury. You might only have, one or two per year, depending on how rough your season is, and depending on, whether or not players are coming and going. You might have some players that come in that have had an ACL injury somewhere, and then there's a lot of turnover. But I'd assume there's probably always at least maybe one or two on your list that you're kind of managing at different stages of their journey. But before we get into that, what was your experience like as, if you go back to your sort of, age when you tore your ACL, what was, I guess, yeah, what was your experience like managing that?
I feel like my experience was probably similar to everyone's in many ways. I accept when I started well, this might be similar for many patients, but
Mm,
this shaped me as a clinician. When I
mm,
started my rehab, I told my clinician, and this was in 2001, so keep that in mind. Back then, they were telling me 6 months for return to play. I told my clinician I wanted to return earlier than 6 months. I kind of like set that target,
yeah.
and he just completely took it off the table. Not possible, yada yada. And that wasn't going to get through my thick skull. So
Mm,
ended up moving to a different clinician. And the way the clinician approached that shaped me. He basically said, I like your goal. I hear you on your goal. If you want to achieve that goal, here's what you have to do.
yeah.
And he set objective markers that I would need to hit to be able to achieve that goal. And the main one was quad strength. And
Yeah.
I think back on that time, and I was doing hammering knee extension early hammering knee extension. And I remember in rehab at one point during my rehab, somebody commented on my quads being like really strong and really good.
Yeah.
And then when I became a clinician, of course, there was like that period of time where they kind of moved away from knee extensions. But that experience, I think, shaped me.
Yeah.
It showed me that lifting is valuable. It
Yeah.
showed me that strength and conditioning work is valuable to the approach. And this is not, you know, to be repeated, but I returned to play not well at 5 months.
Yeah.
Um, and I got, in some ways, clinicians now will say I got lucky. I didn't tear again, but I didn't
Yeah.
tear again. I went on to play D1 soccer.
Yeah.
And yeah, my experience, I thought it was just a very performance-based environment.
Yeah.
Pushed me really hard. I was in the gym lifting 3 days a week and doing stuff on my own every other day.
Yeah.
And I felt like I had a really clear path. I knew where I needed to go to try and get back.
Yeah,
So,
awesome. Do you think
yeah,
that has now shaped you as a yeah, as the clinician that you are now? Like, do you take the sort of the good things that you learned from both those interactions with the clinicians that you had and have kind of taken the good and bad of both sides and now sort of formed it into how you manage, how you treat, how you communicate? Yeah, like how
I
yeah,
think
do you think it has?
oh yeah, I think it always has. It showed me
Mm.
that listening is key.
Yeah.
You can have an idea of what you want to do, but ultimately, if you can't get the person on board with you, it's probably not going to be as effective as you want it to be. So
Yeah.
listening is key. And then for athletes, having a plan. That's like
Yeah.
number one. having a plan. How are we going to get where we're going and where are we going? And in pro sports, like those two pieces are still critical pieces to players' success. When they can't see where they need to go, it
Yeah.
creates incredible uncertainty and I'm going to just say like distress.
Yeah.
And so, yeah, I think those moments for me really put me in a position to say, athletes deserve a say in how things go, and we need to be able to show them exactly what they need to do to get where they need to go.
Yeah. Yeah.
So,
That's awesome.
yeah.
Good points there. Do you find, having now worked in both elite soccer and basketball, is there a, do you see a difference, or what are the differences? What are the similarities, I guess, between the two athletes that you've worked with in the past and what you're working with now? Like ACL, let's sort of, I guess they're all athletes, probably regardless of ACL injury or not. But yeah, what are the differences you see?
Yeah, it's great because I did a long-term rehab in soccer, from start to finish, and I've done one in basketball from start to finish.
Mm,
And they're so similar in kind of how you progress,
mm,
I'd say. You're following, I follow kind of a control the chaos sort of mentality. You're just trying to like move them through the process in a sensible fashion while backing it up with objective assessments and evaluation. In terms of like the sports themselves, basketball is a much more like basically everything they do in basketball is change of direction. Whereas in soccer, you can really do a linear progression, like without being concerned that there's going to be much change of direction just because
mm.
of the space that they're in
Yeah.
and how that functions and how much running and linear running they end up doing during a football match.
Yeah.
But basketball is like constant change of direction. So,
Yeah.
navigating what can you do safely in basketball was a little bit more of a mental transition for me because I grew up in soccer and I knew
Yeah.
knew what to do. But ultimately, the progressions are the same.
Yeah.
You're trying to follow that progression in a sensible fashion to ensure that they can tolerate what they're doing and you're not getting a response afterwards.
Yeah.
Uh, and being able to evaluate whether or not you get that response afterwards.
Yeah.
Yeah, so pretty much the same, but just tighter space and hardwood floor is another variable to think about.
Yeah.
Basketball is a much more individual sport as well. So in soccer, you might be able to get away with doing a lot of the soccer drills with a like on-field performance rehab therapist, which I did
Yeah.
without a coach to like get them exposed to those things. In basketball, you want to try and bring in the coach or coaches as early as possible into that
Yeah.
experience. Um, so yeah, there's a lot more individual touch in basketball, I'd say, which is
Yeah.
another
Do you
thing.
feel like, in retrospect, or in even present day, like, do you think someone that's going through ACL injury and ACL rehab, can they stay connected to basketball a bit easier than a soccer player would be? As in, you could always have like a ball. You could be sitting, dribbling a ball with your hands. You could be sitting down, shooting free throws, sitting down, doing passing drills. Soccer, potentially a little
Yeah.
bit trickier to kind of manage that. Like, yeah, because for me, like, I try to, as much as possible, keep the athlete engaged, regardless of the sport. If they're a football player, I want to sort of, try to keep them at least with a football in their hands, and they could be sitting down passing a ball, so they've got that connection or receiving passes. AFL players, just to sort of bounce the ball back and forth to themselves, to do handballs, all that kind of stuff. Because I think a lot of these athletes, they have their sport taken away from them in an instant. And there's a lot of people saying, no, you can't do this. No, you can't do this. We've got to be safe. We've got to
Yes.
be careful. We can't
Yep.
do this, can't do this. There's a lot of no, 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 no. But
I
what
know.
can we do? So
Yeah.
yeah, what's thoughts and feelings there with the soccer
Yeah.
player, for example? Like, it's a bit trickier.
Yeah. Yeah, I mean it is, and basketball too is at least where I'm at with the Mystics. There's so much more community going on within basketball, community events and team building and socializing, and it's just a tighter space.
Hmm.
Soccer, it's a little bit more serious in some regards, and more you
Yep.
come in, you do your work, and you leave. And basketball is more like, no, we're going to spend 24/7 with each other.
Cool.
So I agree with you. I think being able to be integrated into what's happening is a little bit easier with basketball to be able to get your hands on a ball, work on stationary things, uh, get engaged with the plays and
Yep.
coaching a little bit and whatever. Soccer, that's like that doesn't happen. Um,
Yeah. Is that
yeah,
is that a cultural or a philosophical thing, or is it? And because I don't know, like from I imagine like in the women's soccer competition in America and American, and I think all the way throughout Europe as well, even here in Australia, there's lots of people that come and go. They're here for a season or half a season, and they're off to sort of get a new contract elsewhere. Or there's just so much player movement. It's hard to sort of build that community and connection. I know basketball is probably not that stable at times too. I know we've got a absolutely gun basketball team here in Townsville where we were kind of the
yeah,
national champions. I think 2 out of the last 4 years, and we've got a really strong
yeah,
record here in Australia. But I know the player movement at the end of each season is there's always new players coming and going. So, but when they're here, they're locked in, they're dialed in, and they're all like that
locked in.
community sense is awesome. But yes,
Yes,
I
there's
agree.
a
I
there's
think
a
soccer.
culture.
Yeah.
Yeah, there's a culture with that too, like being locked in with
Yeah.
basketball. It's like a
Mm,
culture.
mm,
And in soccer, yeah, it's like on game day in soccer, any player that's not playing is sitting up in a box
yep.
watching the game. In basketball, any player that's not playing is still sitting on the bench
Yeah.
watching the
Yep.
game. Even those little details, I think, help build community.
Yeah.
But the challenges for the players are the same. They still feel disconnected. It doesn't matter if they're
Yep.
able to shoot from a chair. Uh, they're still feeling disconnected. And I think it's still not an easy process to
Yep.
watch
Yep.
every day, day in and day out, the practices.
Yep.
Um,
Yeah. How do you try and facilitate that? I know it's probably it's not easy in a professional world, but for an everyday clinician in private practice, yeah, I think it'd even be a little bit harder to, I mean, it's never impossible, but yeah, I guess how do you go about that in the background to get people to stay connected to a person that's going through long-term ACL injury? That some of us might take some little tips that we can share with our
I think
patients.
I'm very lucky. I
Yeah.
have great people that I work with, and that community behind the athlete is incredibly important. And calling on resources to help the athlete, talking to coaches, saying what the athlete's dealing with, letting them take the reins on how they build the athlete into their culture and how they want to do that. Um, Working with staff to ensure that what we're communicating to the athlete is consistent
Mm.
and comes from a stable place. All of that behind the player really matters. We also have at Monumental Sports a player development um, department, and they can facilitate events for the player. They can, help the player maybe explore a new hobby
Mhm.
and get them exposed to the things they want to do. And so we have a lot of support behind the scenes that I think helps at least foster a sense of community and support internally for our
Yep.
athletes. Soccer, that wasn't quite the same. We didn't
Yep.
have that level. You'd still do the same things and want to get the staff support behind the player, but with 26 players versus 12 players, it's just
Yeah.
it's just so much
Yeah.
different.
Yeah, and it's I think there's definitely something there for even everyday clinicians working with long termers. I try to just simply just ask people like if we got a young teenager that's injured their ACL and mum and dad are worried about them, their mood starting to change, even someone in their kind of teens and 20s, it's like, well, you can still go down and watch your teammates. You can still go to training. And I think that's like a really simple thing. Like just because you've injured your ACL and you're now going through rehab, it doesn't mean you can't attend trainings. You can't attend games. Like you can still go down and still feel that connection. I think that's important. But it's an interesting thing you said because a lot of people that I have spoken to in the past have found their silver linings, and one that keeps popping up all the time is that they've now got the silver lining to an ACL rehab is that they've now got more time to explore a hobby. What training and games would have take out of their week, and sure, rehab's taking, filling up that void a little bit more, but you can work on those weaknesses. Maybe, maybe you had like a generalized strength problem or a strength issue that you could now work on in the gym in other areas. You could, if you didn't have enough time to read books or, do jigsaw puzzles or all these things, all these other sort of hobby related things that are unrelated to sport that you just simply didn't have time for when you had to go to training 3 nights a week and play games and go to the gym and do this kind of stuff. Like it's trying to find those things and find a new not or find a new community of people as well, like to sort of help as to go alongside with the friends and family that you got. So I think there's just simple messages like that for physios listening to still keep pushing your athletes into other either back down to sport, back down to training, or even sort of have a think about things they actually like doing outside of being an athlete. And so they've just got a different identity. I think that's the big thing here is sport is often
Yeah,
this person's identity, and if they can find things that make them feel a bit more wholer, I think that's
that's
important.
that is
Mm.
important and easier said than done. I mean, this
Yeah.
process for a pro is so threatening to identity for
Yeah.
sure, but then it's also just future and financial stability.
Yeah.
And so you start to realize from a human standpoint that so much of the uncertainty is just dealing with am I going to continue to be able to be a pro at
Yeah.
the end of all this? Is anybody going to want to play me? Will I have a salary at the end of the year? Am I going to get cut?
Yeah.
I think that layer of real threat is it complicates rehab sometimes, but for a pro, the idea of like trusting the process, I think comes up consistently.
Yeah.
And that's the worst, but it is
Yeah.
really true. It's just how are you going to succeed? You stay consistent and you keep
Yeah.
going. Stay
Yeah.
consistent, you keep going, and it requires a degree of bravery and courage to continue to show up day in, day out, vulnerably, knowing most athletes and pros know, that there are risks
Yeah.
involved with starting that return to play process. So yeah, it's a very intensive
Yeah.
process with a person.
Yeah, absolutely. Um, have you worked with obviously with now the Mystics and Seattle? Have you and both these female related, female sports? Have you had much to do with male athletes and ACLers in the male space, or even long termers? And if so, has there been much of a difference you've seen between males and female ACLers?
I am sure in my early career, I worked with some male ACL return to plays, no doubt
Mm.
about it. I think what I would say generally before I started like niching down and working with female athletes
Yeah.
specifically, my sense was that we weren't afraid to push boys
Mm.
as much. And also, boys weren't afraid to be pushed as much.
Yeah.
And so, you might have a player where you're like, we're not going to start running until next week. And they're going to be more likely to be risk takers. Maybe they start that process a little early.
Yeah. Yeah.
And sometimes that works in their advantage, and statistically speaking, I think I think I don't know if I would know the difference of risk for re-tears, but my sense is that women tend to have more risk involved, and I think there's complexity on why that
Mm.
is. Um, yeah, from my sense, I think that boys tend to just be more comfortable taking those risks.
Yep.
Yeah.
Yep. Is there something about working with the female athlete that you really love doing? Like,
I,
is it something? Yeah. Yeah. Tell us a bit more about that.
well, one, I am one, so
Mm.
there's that.
Yep.
Two, I think for me, there's a little bit of like social justice involved. I want to contribute to providing women the best possible resources to do what they're doing.
Yep.
And there's a challenge to that, and sometimes a lot of tears because I can't always do
Yep.
it the way that I foresee in my head, but
Yep.
um, I just want to contribute to that success. So
Yeah.
part of why I ultimately moved this direction was, yeah, it aligned more with my values.
Awesome. Yeah.
Yeah.
It's such a like, ACL injuries is unfortunately we see the risk, anyone that's been around ACL circles enough, they know that the young female athlete is X amount of time, depends on which paper you read, two times, eight
Yeah.
times, but probably realistically sitting around three to five times. But what I love lately has been that sort of shift and that appreciation of just the gendered environment being probably
Yes.
this unrecognized factor in previous years, and now it's starting to get recognised. And there's been waves and there's been changes being sort of pushed along in the background to try and make this change. And yeah, no, I'm glad to see it, and I think it's an important step forward. And have you obviously experienced that? Like, I've heard stories, unfortunately, of like
Chronically.
training fields being sort of saved for the boys. Like like you talk about the laxity and hormones and anatomical reasons, all this kind of stuff. They're the things they'll get blamed all the time. It's like, well, until we've got a fair playing field for female athletes, they get the same levels of strength and conditioning coaches, the same levels of access to sporting venues and high quality training fields and playing environments. Like we're basically comparing apples versus oranges here. So we can't sort of, pin the blame on hormones and laxity and anatomy until we've got that level playing field. So, well, I guess what's your kind of experience there from working in a very, female orientated space, like the highs and the lows? What have you seen from a sporting field point of view?
When I when I got hired at the Reign, at that time, Megan Rapinoe was at that club. Rose
Yep.
Lavelle, Jess Fishlock, big, big names in soccer.
Yeah.
And I went to their training facility and I was like, what is this? It was very, very sad.
Yeah.
And almost like blindsiding in some ways.
Yeah.
And
Right.
that was good because it showed me, okay, this is the reality of things. And it meant that the growth potential was really positive, lots of
Yeah.
opportunity there. But when we talk about discrepancy, we were training in our strength and conditioning area was out of a high school classroom. And, I walked into the classroom my first day or so, and, there's like it's just a classroom. So the ceilings are low, there's weight equipment in there. Everything you would need essentially
Mm.
is there, which is great. Uh, but like the gym floor was like rippling up and waved around, and it was so messy
Yeah.
and so sloppy. And it was my first taste of, I think, what I would just describe as like that gendered asymmetry.
Yeah.
And it was painful. It was really painful. And every organization I've been at, I've seen it. And
Yeah.
it's still really painful. And sometimes I'm
Yeah.
asking myself, why am I doing this? When male teams take priority to train and do the things they need to do. Uh,
Yep.
I'm fortunate to be at Monumental where we have everything we need, like full stop. But there's still asymmetries that you
Yep.
see because it's an NBA team versus a WNBA team. There's gonna be asymmetries. So
Yep.
it's been a like on a personal level, it's been a battle for me just
Yep.
internally trying to manage and navigate how I can have an impact um, at an organization to improve these circumstances when so much of it is out of my control.
Yeah.
And
Yeah. Do you think in the time that you've been in sport, has it changed? Like in the 6 years you've been working in professional sports, obviously soccer, you're not there anymore, but basketball, has it started to
it
shift from what you can see across the landscape?
I would say so. I think,
Yeah.
when I like for sure, it almost took like a steep
Yeah.
improvement. When I was hired at Rain, there were only two medical staff. It was me and another woman athletic trainer.
Yeah.
And that's for 26 players. Like that
Yeah.
was a lot.
That's
And now I'm in an
under-resourced.
organization. Yeah, it's not enough staff, I can tell you that.
Yep.
Then like a year later or less than a year later, they signed a new CBA that said we need more staff. And so we were able to hire more staff. And I think pretty much every organization I was at on the NWSL side after that point has just expanded.
Yep.
That doesn't mean that it's enough just yet, but expanded. When I came into basketball, I didn't really know what to expect, and I feel like I had a great resource on the inside to be able to tell me what was going on at the Mystics. I knew when I was going to the Mystics that I was just going to have what we needed. So
Yep.
we have four medical staff to 13 players now, and
Yep.
three performance staff, a dietitian, and a mental performance staff. And so we're, I think, in just a great position to
Yep.
be able to focus on the work and not have to stress and worry as much about kind of the noise that comes with,
Yep.
the asymmetry of work.
Yes.
I feel like I'm right now as close as I've gotten to
Yep.
symmetrical,
Yeah.
which
Awesome.
is a good and exciting place to be because I feel like there's just a lot of potential there.
Yeah, agree. That sounds positive, and we probably should speak about some of the work that you do. It's great hearing the background story and hear the different. I think it's all important context, though, right? Like I think you know it's ACL rehab in an elite environment. It's very different classically from males to females. There's probably very little sports where there's probably an equal level playing field with access to medical care, physiotherapists, athletic trainers when you put men and women side by side, and it's very, very different. So it's nice to hear there's been a change and the asymmetries getting getting less. Like our limb symmetry index, we always try to
Yes.
sort
That's
out. There's
maybe that's a
the
good way to consider it, right?
yeah,
Is
yeah, that's right. We want to get to 100%.
yes, we
Sort of
do.
hang out at 80 or 90%.
Yes.
There's my dad joke for the day. So getting into probably some of the nitty-gritty about ACL rehab for a bit. What's like I think there's you probably speak to anyone in ACL land. Like, what are your, I guess, core? Do you have a core philosophy to ACL rehab? I know it's a very broad question, but like, is it like for me, like, obviously quads are such an integral part of ACL rehab, but obviously there's more to ACL rehab than just get your quad strong. Like, I guess what's your overriding approach to ACL rehab?
I would say work with the person.
Yep.
And that's just as simple as that.
Yep.
It's a dynamic process that evolves as you continue the work, that can change on a dime, that, you know, you can't always predict, that has influences beyond just you. And so for me, it's just working with the person and
Yep.
seeing them and hearing them and working to do whatever you can to foster their development towards sport.
Yep. Yeah,
Yeah.
that's good. It sounds like, I mean, we've probably started to hopefully move away from, I guess, recipe-driven protocols throughout
Yeah.
rehab, and I think that's probably an important step forward for any young career clinician. But that's kind of like, I guess, how you learn. Like you probably need to have like a few kind of guidelines or some kind of, process or protocol to sort of help you through. But there comes a stage in your life where, the person sitting right in front of you in the context of their lives and the context of their, playing position, their age, their injury history, the time
Yes.
available, where you are in season versus off season, like it gets pretty tricky after you sort of can,
So much harder than any rehab I ever did outside of pro.
yeah,
Like being in pro, managing an ACL rehab is by far been the hardest, still the hardest thing to navigate
yep,
because of, of course, we've got our standards and our principles as clinicians. And but where does that stop?
mm,
And, if you've got an athlete who meets five of seven of your standards. Is that enough? Are you
yep,
going to stand on a line and tell everyone no when they're able to do the things they're doing? You have to rely on your resources. You have to work collaboratively with people. You have to consult with experts such as yourself
yep,
and be willing to not be the one with the answer and
yep.
not to have the answer, honestly, all the time.
Yeah, and it's absolutely okay not to have all the answers too. It's an interesting point you
Yes.
make. Like, is in your experience, and we probably even haven't got into the early stage, which we'll get to in a second. But
Yeah.
what you just said there, I think, is an important one. Like, do you have like a hierarchy? Like, say someone is only ticking off 5 out of 7 kind of boxes that you want them to hit before they play their first game or have their first unrestricted scrimmage, where we're now sort of bumping up their risk and we're getting into a really chaotic environment. Yeah, like do you have a kind of a weighted kind of approach that, they got 5 out of 7. Yes, these 6 and 7 numbers are pretty important, but look, if they can't quite get them yet, we know that'll probably happen with time. Like, is that something that you kind of embrace and are happy with most of the time, or are you like, no, we need to have 6 and 7 done before we get this player on court? What's your kind of line there?
I think I think that let me think about this. For me professionally, I have learned that holding lines isn't always effective
Mm,
to getting to the outcome. And for pros, so much of what you need to see is can they do the movement? Can they do, linear running?
yeah.
And repeating that over and over and over again. And certainly we're going to try and get their quads to the strength they need to be before we've hit that and done it. But what we're looking for is can they? What's the quality? And do they have an effusion afterwards?
Mm.
Is there a
Yep.
response?
Yep.
And when you stack days like that, and these players are playing every day, nearly every day, 5 days a week, training, um, sometimes more. In a rehab, when you're stacking days, so often you end up seeing what they can do maybe before they've passed some of your assessments.
Yep.
Because we're trying to also manage their physical load and perform the assessments in strategic time frames so that they're not sore for the work that we're doing on court or whatever it is. So you may end up, ticking a box while they're on court, sort of
Yep.
accidentally,
Yep.
in some ways. And being
Yep.
able to see that and see that repetitively day in and day out, it almost makes the process of like decision making sort of easier because
Yes.
that's part of the tick box, I guess you could say, to move to kind of the next level as well. It's like, okay, we've got the linear stuff down and they've not responded. We've been doing this for 2 weeks. Maybe their quad is a little bit behind. Let's like just how can we just turn up the dial just a hair where we're not
Yep.
exposing them to like the hardest thing, but maybe that just like the next hardest thing to keep it
Yep.
interesting and engaging and see how their knee responds, see how they
Yep.
respond. 9 times out of 10, they're scared too. So,
Yep.
when they're out there, they're probably, and we might coach them into this, let's just kind of go light today. Let's just practice these movements. Oftentimes, I'll practice movements without the basketball involved. Then we'll pull the basketball in. And so it's such a more emergent process, I feel like, than what you get in the real world because you're
Mm.
just every day you can see everything that they can do. You can see the quality. Are they afraid? You're communicating with them. They're telling you, I'm afraid, or that felt great. No concerns at all.
Yep.
And repeating that over time builds confidence for everybody. So I feel like you can't get too stuck in the weeds with being a hard ass on the standards
Yep.
when you're being able to witness what they're able to do.
Yeah.
Yeah.
Yeah. That's
They still
that's
matter.
all.
Don't get me wrong. They still
Yeah.
matter, but
Yeah, absolutely. And I think that's an important also too. Like, it's part of, like the professional environment when you're there, you get to see it in real time. I think the everyday clinician who might only see someone in the back end of the rehab in their late stage rehab processes, you might get them to, you may maintain communication, every few days via emails to, hey, how's your knee pulling up, any changes in your swelling, everything moving all right. Because if you don't have the luxury of going to watch them train, you just have to sort of rely on feedback, and you may not be able to physically test them for 2 weeks or 3 weeks, so you kind of are flying a little bit blind. But that's the differences between working full time versus part time. So it is, but I think I agree. I think the fact that they're there, they may not be perfect. They still may have ticked off the main non-negotiable items. Quad,
right.
hamstring, calf, jumping ability, jumping symmetry, whatever your checklist is. But if there's still a couple of things that are quite not right, the fact that they're there, training, competing, not getting swollen, able to rock up two
Yep.
days later, train, compete again, and rinse
Yep.
and repeat 2 or 3 weeks. That's clearly telling you something. So
Yeah.
it's a
Yes.
sign that you can progress forward, and training is a stimulus. And I think that's the thing. I
Yeah.
think we've made so many errors in the past where in people get cleared for a turn back to sport. They've been held out of the training environment for too long, and then, they're playing their first competitive game within the first month after really small training exposure times. Like, there's no doubt that contributes to our high second ACL injuries that we're seeing in our
Yes.
young kids. So it's yeah, I think there's definitely objective markers we need to have, but we also too need to be quite flexible, and maybe
Yes.
maybe just
Yes.
have a
You,
have a
you're
list.
Yes, because you're
Yeah.
right. I mean, they're building effectively what they're building when they're on court every day or
Mm.
wherever is tissue tolerance.
Yep.
And over time, that is helping you as the clinician with their strength. Like
Yep.
for sure it is. And we see that in healthy athletes during our season. When we test them at the beginning to when we test them at the middle of the season, we
Yep.
have improvements just by virtue of being exposed to the environment. So there's a
Yep.
certain level of trust that you have to have as the clinician that things are going to happen and you just got to give it time and you got to make sure people understand what to do and how to nurture that to a blossoming flower and
Yep.
hopefully all goes well.
Exactly right.
Yeah,
Do you have
yeah,
any
it's
key
scary.
non-negotiable items on your list of so
quads
with your.
are
Yep.
quads are queen.
Yep.
I mean, you've just got to have strong quads. Like it's just and we don't need to be 100%.
Yep.
But we need to be able to test isometrically, test isokinetically, and translate that into physical movement, double leg jump, single leg jump, and on-court movement.
Yep.
And so those are kind of like my hallmarks, I'd say, is yeah, the quads, isometric, isokinetic if you have it,
Yep.
and the physical movement piece with the movement on court or wherever, and the jumps. Those are really
Yep.
important for
Do
me.
you have much, do you kind of utilize like a hop test battery much these days, or have you sort of moved away? I know personally myself, I've probably
Yeah,
moved away a little bit. I probably have now shrunk my testing battery to quads, hamstring, single leg vertical, double leg counter movement jump, just to, and it's probably, back end of rehab. I'm probably not too worried about it anymore. I want to have a look at single leg vertical, single leg drop jump. I've probably really sort of thinned it down, but I've also got the luxury of having force plates and isometric handheld dynamometry and those kind of things. I can understand why clinicians who don't have tech, they need to probably have some of their horizontal hop test battery in the mix
yeah,
still. But yeah, I've definitely shifted away and really thinned it down. Have you seen your kind of battery evolve and change and sort of thin down over time, or have you come back to things that you've probably ditched maybe 10 years ago? Have some been sort of dusted off and brought back in? Like what's I guess what's the evolution of your return to sport batteries?
yeah. I would agree with you. I've moved away from the hop tests. We will still use it as a light gauge. So maybe we'll say jump 80% on both sides to
Yep.
a player and see the movement quality and then a rough, you know, estimate. Even just an eye test can give
Yep.
you a lot of information,
Yes.
but we're not testing that. I don't think like it's not one that I'm leaning as heavily on as I did back when I
Yep.
didn't have tech. Now that we have tech, it's just the data is so much more precise.
Yep.
And I heard a horror story about the hop test once about a clinician here in the States, and I don't remember who it was, who is very well known, who had a player tear their ACL while they were doing the hop test. And I was like,
Oh, yikes.
it's
Yeah.
maybe not one I want to do as often. And I think it made me nervous about the test itself, which you can understand if you're performing a maximum jump before you're
Yep.
ready. But we'll use it, as a gauge and just cue the player on effort and movement quality so that we're not necessarily going for a max jump, but we can still gauge, okay, they're jumping 80% on both sides and that looks symmetrical. So that's
Yep.
a good start.
Yep. Yep.
Um, I like the precise data that you can get from the devices. So
Yes.
much more reliable and consistent, and you can retest it over time and
Yes.
have better comparisons.
Yeah. With your ACLs, would you be tracking, say beyond the first 3 months? Would you be tracking monthly, every 2 to 3 months? Like, what would your processes be? We'll eventually work back to the early stages in a second, but
Yeah.
are you, do you have like a check-in sort of process, like a formal testing battery process, or is it kind of, just do it weekly to sort of see how things are going?
So in the basketball environment, we communicate to our performance staff what we want to see, and then they sort of find the right windows for that. And so with our like isokinetic testing, I think we probably did that every 3 months or so, somewhere in there.
Mhm.
And with other testing, you can capture that maybe more on like a monthly basis or every 6 to 8 weeks. And, you just get the information and sort of move on. And maybe a week later, you'd be like, oh, can you do this test? And maybe you'd add a different test in the middle of all of that to see where
Yep.
they were at with something else. Um, so that's kind of how it's been handled. And in soccer, I handled the whole journey. So I would test
Yep.
kind of whenever I wanted to, whenever I needed to.
Yep.
Um, yeah. So
Yep.
just a little bit
Cool.
different. Yeah.
Yeah, it's good. I mean, personally for me, I just once again I'm not in the elite daily grind of seeing people, but I certainly for any kind of anyone that's listening and interested in sort of my processes, I have probably one monthly check-in every 6 weeks. I kind of hit the 3 month mark, and usually people are knocking on the door saying, let's
Yeah.
start running at three
Time.
months. And I'm like,
Yeah.
let's just see, let's see how good you are. And yeah, if they're close, like cool, all right, well, yes, we can start a run to walk program, but always thinking ahead. And I think that's the whole thing about testing. You kind of the whole test is to see where they're at, so that you can kind of get a gauge of what things do they need to do, what qualities do you need to bring into
Exactly.
your rehab or your on court processes, so that they're getting nearer to your
Yes.
return to play kind of checkbox. And that's where you need to be thinking, all right, well, if this is where they are, we need to fill that rehab block with exercises or processes A, B, and C. And that's where I probably, as an early career clinician, I was just like testing for the sake of gathering numbers, but not really knowing what to do with them. And I think that that's like an important part, and that comes with time. Working with some great people have sort of taught me how to kind of reverse engineer things and sort of figure out, how to kind of, get what the numbers mean and how we're actually going to, take a quad strength that's at 70% limb symmetry and try and get it up to 80% over the next, 6 weeks. What things do we need to bring in? How do we change the rehab program and so on and so forth. So I think that's the kind of evolution in your practice is, get comfortable with, I guess, developing processes on testing and know which tests are important and when. But then importantly, we need to know what to do with those numbers and how we're going to evoke a change. I think that's all part of the learning curve, I guess, with growing
And
as a clinician.
I bet you as a clinician would know probably ahead of time a rough estimate of how that person would test
Mm,
just by virtue of watching them during their rehab sessions and
yeah,
seeing what they can do and how they move and how they recruit with their knee extension on the injured side versus their non-injured side.
yeah,
So, as physios, I think our great one of our greatest skill sets is we're just sleuths. We're
yeah,
testing every day,
yeah,
you know?
yep.
Um,
Yeah. And
yep.
I think sometimes, and it's, the outside of just the pure strength and function sort of match, strength and hops, it's the ones that are coming in a bit fearful, or, the ones that are going to rate low on the ACL RSI questionnaire,
That's
or
another one. Yes.
yeah, so some
Mhm.
other questionnaires that sort of determine readiness and confidence and even daily function. You can kind of half also identify if you spend enough time with them, asking them questions and seeing them move, and how kind of ask someone to do their first box jump, and you kind of know who the ones that are going to score great on their ACL RSI versus ones that are going to just take a little bit more time and maybe
Mhm.
like a little bit of hand holding and a little bit more confidence boosting and building. And there's a lot of sort of subtle clues where as clinicians can take away just from just being present in our sessions, making sure we're
Yes.
actually watching every movement, not distracted on our
That
phones
being
or
locked in, Nick,
whatnot.
being locked in.
That's it. You got to be part of it. You got to be there.
Yep, you do.
Um,
You totally do.
yeah, I must admit, I must have been in my early careers. I'd probably my professional sport. I worked a season, and I'd catch myself every now and again. Just I was doing patient notes, or doing notes from the day before. I needed to sort of check myself and make sure that I was watching the session, because I'd probably get 5 or 10 minutes in playing catch up or doing like a research, thing, or, whatever it was. So it was like, oh no, I've got to put my laptop down and actually watch and lock in. Otherwise, I might miss something. So, like you
Mhm.
got to be there, got to be present. So yeah, don't get
Mhm.
distracted on your phone or your laptop.
Yeah, it makes a difference. It also makes a difference to the person's experience of their work with you
Yes.
when you're locked in, you know?
Yeah.
They're, they're
Yeah.
more likely to be engaged with the process if you are
Yeah.
as well.
Yeah,
Yeah.
yeah, great tips. Now to the early stages, what are your kind of key kind of I guess non-negotiables early? Like say the first 6 weeks post-op ACL, what are the things that you want to see out of your patient? In terms of clinical, I guess, testing, examination, things they focus on and prioritize in their rehab. What are your first 6 weeks like in ACL management?
I would certainly say that their range of motion and their ability to walk and recruit their quad is those are probably the three main hallmarks is
Mm.
getting those back. And subsequently, if you're getting your range of motion back, that means more than likely that your swelling's coming down as well.
Yep.
Uh, but those three things for me, I think, are crucial to their long-term success. And
Yep.
when I say range of motion, I mean full range. Getting that knee extension back is critical, and I think that I have too many cases in my history as a clinician that I feel like I could have done a better job of
Mm.
problem solving the ways to help them get their extension back. Um,
Yep.
yeah, but yes.
Yeah. Do you have any particular like favorite, things to, in keeping in mind both everyday clinicians and elite athletes, but do you have favorite tools or like are you a fan of like, ice compression, game readies, blood flow restriction, NMES,
We
all
use
the
it
kind of
all.
little, yeah. You
We
throw
use it all.
everything at it.
Yeah.
Yeah.
Yeah. I love the NMES. I
Yeah.
love it. I think that it's a game changer. And so I use NMES like that's going to be something we're going to use very regularly in early
Yeah.
stage
Yeah.
rehab.
Non-negotiable.
Beyond, yeah, beyond that, I'm less concerned personally about getting their muscle girth back,
Hmm.
in those moments. But I think that athletes really like it. They like it and they hate it at the same time. They like that it makes them feel like they're working hard. So it's a balance. We use everything under the sun in the pro world. Anything that will help the athlete feel better, we're gonna probably give it a try. But in
Yep.
terms of like real hard clinical utilization, it's the NMES that's gonna really take the cake, and we'll use it for knee extensions and TKEs and walking and anything to help really click that quad into
Yep.
gear. Um,
Yep. Yep. Agree. Okay, it's I think like every person that I've spoken to about, anyone working in the elite world, anyone working with ACL rehabbers in a high volume, everyone's says the same stuff. I'm not picking and choosing people who just have got the same approach to me. It's, people that actually, see it every day.
Yeah.
How
Yeah.
important those quad recruitment earlier, because like you said it perfectly, like you look after the swelling. We're going to improve the range of movement, with the greater range of movement, less swelling. We're going to have better quad recruitment. We get better quad recruitment. We're going to have better walking capacity. We're going to have a better active terminal knee extension. It's just, I think we can sometimes just can't see the forest for the trees some points, and that's why for me it's like, okay, well, if we can just look after if we can look after pain, if we can look after swelling, then usually the quads often just sort of come along, pretty well, but they can definitely do with a boost, and that's where electrical stim is really nice.
Yeah.
So yeah, they're 100% agreement, all those kind of things. So I've got another person that's in my corner. So anyone that doesn't listen to me, make sure we listen to Ellie.
I'll say anecdotally as well, I have noticed that NMES helps tremendously with swelling. So
Yep,
I use it on players who have, maybe they have chronic changes in their knee and, they deal with occasional swelling and we'll use it passively, actively, and the next day, I'm telling you, the swelling will be less.
yep, less. Yep,
Uh, and it's just, what comes first? Is it the swelling that shuts the quad down, or is the quad need more recruitment and that's why the swelling is there? I don't really know, but I find that it's incredibly useful towards
yep,
helping reduce swelling as well, which makes
yep,
sense. It just, makes
absolutely.
sense.
Yep,
Yeah.
very good. You mentioned before, like if you sort of felt like you made a few early mistakes as a in your career, what were kind of some of the sort of harshest lessons you learned early on, and how did that kind of change you, or did it change you in a positive way?
Yeah, I think mistakes will always change you in some way. I just remember cases where, I'd be like stretching somebody's knee and they'd be in tears.
Mhm.
And I just don't think that's necessary all the time. And then their extension wouldn't even come back. And so it's like, is it
Yep.
even worth it? And so things like that, where, you're doing something perhaps because you've seen it done that way, or you think it's the only way. And I think that as I've gotten older as a clinician, you realize that the forest through the trees, what you're talking about, trying to stay calm and stay patient with the process is part of it, but doing the right things early on makes a difference. And
Yep.
so, yeah, those sorts of things, I think back on them sometimes, like, oh, I wish I had just been nicer to that person,
Yeah.
you know?
Yeah. And what
Yeah.
about, any young physios that are listening in here, or even yeah, if you could go back and talk to yourself as a new grad, what would be some advice you'd give yourself or an early career clinician if you could yeah, go back in time?
You have your whole life to work, so there's no rush. I talk to many young clinicians who are anxious to get in the pro world. How do you do it? How did you do it?
Mhm.
I'm very happy to try and help and put them in a good position to do that. And I also think that having not done that early, I'm a better clinician coming
Mhm.
into the pro world than I would
Yep.
have been. So, just staying patient with the process and recognizing that you have your whole career to work, and pro sports is never permanent.
Yep.
It's a naturally volatile type of job. It comes and it goes, and you're lucky if you're staying at a place for more than 5 years. So,
Yep.
you know, just take a breath and keep working the process.
Love it. Love it. I 100% agree. I think I mean, I go back to when I was a new grad, and I had the balls to say, or yeah, I used to be that confident and cocky as a new grad, thinking I could be the head physio for this club. I'm like, yep, I've got, great PT experience. I was a personal trainer before I was a physical therapist. I'm a bit older, a bit more, mature and experienced. I could walk into a club and be the head physio and feel like I could do a good job. I would be absolutely hopeless. And it took me until I got that job and that role 6 years later, and a lot of experience working at lower levels, younger athletes, different sports.
Yes.
I worked with both male and female rugby league players, soccer players, different regions of Australia, and then eventually got the role working in professional netball here in Australia when I was, I think, 6 or 7 years out. But that 6 or 7 years, it was such a foundational experience for me where I could still continue. I was being mentored, I was learning different sports, I was doing professional development, and I was able to make mistakes. I made mistakes constantly, and
Yep.
when you can make mistakes in a less intense environment with less scrutiny and less eyes on you, yeah,
Yep.
that's where you learn. And I still made mistakes at the professional level, but I was able to deal with them better because I was a little bit more
Yeah.
mature. So, yeah, I think about the young, my young self saying, "Oh yeah, I could be a head physio for a sporting team in my first, second year." You're joking, and the same message I tell everyone now. We get new grads come into our clinic every year, and they want to be working, full time with the rugby league team here in our city, or the full time with the basketball team. And like, you don't need to pay your dues. Like, we're not saying that you need to, wait in line and wait your turn. Like, we're just saying, just maybe go and learn some other things first and build your experience and just be patient. Your time will come, but like, it's an important part that you learn.
I'm a little biased now, but I think it helps create creative clinicians
Yeah.
when they've had just real world experience,
Mhm.
And personally, I think in the pro world, you're exposed to, acute injuries, and you have to be able to quickly evaluate and assess and make decisions and collaborate with other people. You gain that through experience and reps.
Yep.
And if you come into the pro world and you don't have those experience and reps, it doesn't mean that you can't do it, but the experience and reps are gonna set you up for success. Like they just will. So I'm a big fan of people who maybe didn't go the classical route, maybe because I didn't go the classical
Yep.
route.
That's right.
And yeah, feel like it adds a valuable element to the pro environment, in my opinion.
Yep. Yep. Agree.
Yeah.
Yep. I agree wholeheartedly.
Yeah.
Last one, Ellie, before we wrap up, because I don't want to take too much of your time. For someone that's going through ACL rehab right now, what would your advice for them be?
Ooh, I would say just this is gonna be so just keep putting in the work, show up, just continue to show up in the
Yep.
process. And that is what will lead you to success.
Yeah, agree. That's
It
there's not I 100% agree
can
with
be
that
the
message.
hardest thing to do.
Yeah.
It's gonna be the hardest thing to show up every day to do the work to get better, but it will pay off. Yeah.
Yeah, I agree. If one of my favorite sayings, I think Winston Churchill said it, if you're going through hell, keep going.
Yes.
There's no point stopping or going
Yes.
backwards.
Yeah.
And that's effectively, like if you're just really frustrated in ACL rehab and, you're having, a rough week or a rough month, I think, the worst thing anyone can do is kind of just give up and not sort of continue to sort of find a way out.
Yeah.
Yeah, because the outcomes I've seen for those people who did unfortunately throw the towel in, we're looking 3 years, 5 years down the track. Their
Yeah.
knees, their knees are hard. You're hard to fight back from a knee that's already started to degenerate and show some mild to moderate OA changes after 5 years of just disuse or crappy rehab that's now kind of come along for the ride. You can always turn things around, but don't give up. I agree with that message wholeheartedly.
Yeah. Yeah.
Well,
Yeah.
Ellie, it's been a lovely chat. I learned so much from
Great.
everyone, and selfishly, I that's why I do these things. I get to learn and get to talk shop and talk about the thing that I love, outside of my
Well,
family.
I also just want to shout out Amy Arundel, who I'm sure you know
Yes,
decently well.
yeah, Amy I was on here last year, so had a good chat. Had many good chats with Amy. Yeah,
Yeah, she's a very good friend of mine, and she is also one of the reasons why I continue to show up and do this work. And we all need people like that. So I just wanted to give her a little shout and a little love because I think she's exceptional and she's been a great resource for me as I continue to navigate the basketball world. So
yeah.
yeah.
Agree. That's it's a lovely, lovely message, and yeah, I 100% agree with your kind words about Amy. She's a pillar of knowledge, a fountain
Yeah.
of knowledge, and yeah, someone I once again also to look up to and respect and appreciate her work and her work that she's done. So if we made it this far in the episode, make sure you go back and listen to my interview with Amy from last year. Ellie, feel free. What can you tell us a bit more about if you're happy to take on more clientele, feel free to give your online coaching a shout out,
Yeah,
or are
I
you too
I'm
busy?
not taking yeah, I'm not taking any new clients right now. But you're welcome to follow me on Instagram at Dr. Ellie Somers. And anytime you want to sync up with me, I'm always happy to have a chat. I love connecting with fellow physios around the world and helping foster young clinicians' growth and, just being connected with people. So don't hesitate to give me a DM.
Awesome.
It's
Yeah.
thank you. I'll be sure to pass on those messages too in the blog that I write up as well. So
Thank you.
Ellie, thank you very much for your
Thank
time
you, Meg.
tonight. Great to chat.
Great.
Always great to chat and great to connect. And yeah, we'll have to do this again sometime.
I would love to stay connected. Absolutely.
Very
Thanks,
good.
Mick. I appreciate you.
All right, ACL Hubbers, that's it for this evening. If you like this one, feel free to like, share, and share it around with your friends and mates. And stay tuned for the next episode of ACL interviews on the ACL Hub coming up soon.